Welcome to the training for medical assistants in the Columbia Suicide Severity Rating Scale. Next slide. We are going to focus on step 2, risk assessment using the Columbia Suicide Severity Rating Scale. The C-SSRS is designed to quantify the severity of suicidal ideation and behavior. It is the only screening tool that assesses the full range of evidence-based suicidality and provides criteria for what to do next. So, who can administer the C-SSRS? Anyone. And when should you administer the C-SSRS? When a patient endorses question number 9 on the PHQ-9 or a population-specific tool that identifies risk. Any non-zero answer leads to the administration of the C-SSRS. The Columbia Suicide Severity Rating Scale can be administered over the telephone, virtually, and in person. It supports suicide risk assessment through a series of simple, plain language questions that anyone can ask. The answers help users identify whether someone is at risk for suicide, assess the severity and immediacy of that risk, and gauge the level of support that that person needs. So once again, who can administer the C-SSRS? Anyone. Next slide, please. By using the C-SSRS, we ensure that we are using an evidence-supported screening tool, which is approved by the Joint Commission and also ensures that we are providing standardized care for our patients. In the next slide, we're going to talk about administering the C-SSRS. The C-SSRS consists of 6 questions that can be asked in a few minutes with no mental health training required to ask them. Depending on patient's response to the questions, it is a minimum of 3 questions and a maximum of 6 questions. It takes approximately 5 minutes to administer, and you ask the questions using the exact wording. Simply read the questions as they appear in EPIC. Next slide. So we are going to look at the first 2 questions. I'm going to read them, and this is just how you would ask them. In the past month, have you wished you were dead or wished you could go to sleep and not wake up? In the past month, have you actually had any thoughts of killing yourself? Patient response options are yes or no. If the patient responds yes to question 2, EPIC will go to question 3, 4, and 5. If the patient responds no to question 2, then go to question 6. In the next slide, we will look at questions 3, 4, and 5. Have you been thinking about how you might kill yourself? Have you had these thoughts and had some intention of acting on them? Have you started to work out or worked out the details of how to kill yourself? Do you intend to carry out this plan? Just to reiterate, if the patient responds yes to question 2, EPIC will go to question 3, 4, and 5. If the patient responds no to question 2, then go to question 6. Next slide, please. The last question, question 6. Ask the patient, have you ever done anything, started to do anything, or prepared to do anything to end your life? If the response is yes to question 6, then C-SSRS and EPIC will cascade to a follow-up question or question 7. How long ago did you do any of these? There will be 3 choices: within the last 3 months, between 3 months and a year ago, and over a year ago. Remember, the questions will appear in EPIC in the order in which they should be asked. Once complete, the C-SSRS will provide a score of no risk, low, moderate, or high risk. Please inform the provider of the patient risk level on the C-SSRS and follow clinic workflows. Now we're going to look in the next slide as to how this would look in Epic. When you are in the patient chart in Epic, go to the Ambulatory Screening tab. There you click on the Psych tab, and you will see the C-SSRS on the left column. Once you click on it, you will see question 1, 2, as well as question 6 with the follow-up question. Questions 3, 4, and 5 will cascade depending on patient response to question 2. Next slide. Now we would like to ask you to break into groups of 2 and ask each other the questions to practice. Please note that this exercise is for training purposes only. On this slide, you have the questions. Have a look at them. Read them just as they appear in Epic. Thank you very much for your time.